Good evening and welcome to City News. The Ford government has passed a new healthcare bill that is stoking privatization concerns. While the Premier and Health Minister argue Bill 60 will eliminate the province's surgical backlog, critics say it will undermine and dismantle the publicly funded healthcare system.
Who will have the courage? Who will have the courage to listen to the people of Ontario and vote against Bill 60?
We're bringing healthcare back to the standards of a world-class healthcare system, the best in the world.
Healthcare workers and advocates filled the galleries of the legislature in protest as MPPs challenged the Premier on his government's controversial new healthcare legislation. Bill 60 will allow more OHIP-covered procedures like cataract surgeries, MRI and CT scans, and eventually knee and hip replacements to take place at both not-for-profit and private for-profit clinics. The government says it will reduce wait times for patients at no cost. Opposition members disagree.
What this bill actually allows is the simplest surgeries to be done for the highest price. They will be funded by our tax dollars. They're letting private for-profit companies have unfettered access to the demand that exists in our healthcare system.
I think you're way off on this.
Order.
We need more opportunities, convenient care closer to home. We're going to shorten the list. We're going to give people the care they need in a rapid fashion.
The ayes are 68, the nays are 34.
The ayes being 68 and the nays being 34, I declare the motion carried.
Third reading of the bill, troisième lecture du projet de loi.
Cries of shame rang through the legislature the moment the bill inevitably passed with a Conservative majority.
I think that the government should be hanging their heads in shame.
NDP leader Marit Stiles accusing the government of manufacturing a healthcare crisis to further privatize the system.
They've had the dollars and they've underspent over and over again. They only have the interests of their insider friends at heart and not what's good for the people of this province. And I think this is going to take us in a terrible direction.
Opposition members stressing there are better ways to clear the surgical backlog. Rather than move surgeries to for-profit clinics, move them exclusively to not-for-profit or hospital-affiliated clinics with credible protections.
Every single opportunity that this government has had to institute those protections, all summarily shot down.
And look, there are no guardrails around this legislation. There is nothing in here that's going to stop private for-profit clinics from upselling or from poaching staff.
Advocacy group Ontario Health Coalition says it is considering legal action after hearing from dozens of patients who were already forced to pay out of pocket for OHIP-covered surgeries.
If you're a private clinic owner in Ontario and you think you're going to set up shop here and charge OHIP and charge patients on top, you have another thing coming. Keep your investment money out of our public health system. We don't want you here.
And notably, the health minister didn't come out to respond to reporter questions after the bill passed this afternoon. The province has said there are more than 200,000 people in Ontario currently waiting for surgeries. And to some other news out of Queen's Park, a Liberal MP will become the first official candidate to run in the Ontario Liberal leadership race. Nate Erskine-Smith announced he will officially launch his bid at a rally in Scarborough tomorrow night. He's been the federal representative for Beaches East York since 2015 and says he will take on big issues like healthcare, housing, and climate. The leader will be announced December 2nd.